Assalamualaikum and hi. Today I'm gonna present my oral presentation. The topic that I choose is anxiety. Before I get started, let me introduce myself. My name is Muhammad Rahizan bin Abdul Rahim from class DKM 1A. My matrix number is 24 DKM 21F 1057. I'm gonna start my presentation with the definition of anxiety, followed by the symptoms of anxiety and types of anxieties. Firstly, let's move into the definition of the anxiety. Anxiety is an emotion characterized by feelings of tension, worry, thought, and physical change by like increased blood pressure. People with anxiety disorders usually have recurring intrusive thoughts or concern. They may avoid certain situations out of worry. They may also have physical symptoms such as sweating, trembling, dizziness, or a rapid heartbeat. Anxiety also can be said a feeling of worry, nervousness, or unease about something with an uncertain outcome and strong desire of concern to do something or for something to happen. The second main point is symptoms of anxiety. If you're feeling unusually irritable or on edge, you may find it useful to talk to a family member or your doctor. Feeling irritable and anxious can be a symptom of a mental health condition like depression, anxiety, or bipolar disorder. Secondly, GAD is a common anxiety disorder that involves constant and chronic worry, nervousness, and tension. Everyone gets anxiety sometimes, but if your worries and fears are so constant that they interfere with your ability to function and relax, you may have generalized anxiety disorder or GAD. Thirdly, according to a 2015 study of adolescents in the United States, there is a direct link between anxiety disorders and irritability. Compared with self-reported worries, young and middle-aged adults with generalized anxiety disorder reported more than twice as much irritability their day-to-day lives. Then, anxiety can also make a person lose focus in doing something extra such as driving a car. It can also disrupt the focus of students who are studying when they have a sudden attack of anxiety. It is not surprising if a student fails in exam due to anxiety that causes students to lose focus. Last but not least, sleep difficulties, such as problems in falling or staying asleep, are known as insomnia. Insomnia is a common sleep disorder that can make it hard to fall asleep, hard to stay asleep, or cause you to wake up too early and not to be able to get back to sleep. You may still feel tired when you wake up. Insomnia often occurs regardless of young or old age when the individual has anxiety. This insomnia will make a person late to start the next day, such as late to work or late to school. The last main point for my presentation with video is the types of anxiety. The first one is generalized anxiety disorder. People with GAD, the worry is often unrealistic or out of proportion for the situation. Daily life becomes a constant state of worry, fear, and dread. Eventually, anxiety can even dominate a person's thinking so much that to do routine things at work or school, socially, and in their relationship. But they find it hard with treatments to ease anxiety, so it not ruin your life. One fact that I want to share is nearly 4 million adult Americans, or about 2%, have GAD during the course of a year. It most often begins in childhood or adolescence, but can begin in adulthood. It is more common in women than in men. Secondly, panic disorder. Panic disorder will cause panic attack, which is a sudden feelings of terror when there is no real danger. You may feel as if you are losing control. You may also have physical symptoms such as fast heartbeat. Factors that may increase the risk of developing panic attacks or panic disorder include family history of panic attacks or panic disorder, major life stress such as the death of serious illness of a loved one, a traumatic event such as sexual assault or a serious accident. Thirdly, specific phobia. Unlike the brief anxiety you may feel when giving a speech or talking a test, specific phobias, long-lasting, cause intense physical and psychological reactions and can affect to your ability to function normally at work, at school, or in social setting. Specific phobia are among the most common anxiety disorders, and not all phobias need treatment. But if a specific phobia affects your daily life, several therapies are available that can help you work through and overcome your fears. A specific phobia involves an intense, persistent fear of a specific object or situation that's out of proportion to the actual risk. There are many types of phobias, and it's not unusual to experience a specific phobia about more than one object or situation. Last but not least, the last types of anxiety is agoraphobia. Many people assume agoraphobia is simply a fear of open space, but it's actually a more complex condition. Someone with agoraphobia may be scared of traveling on public transport. For instance, a person with agoraphobia may avoid traveling by airplane due to a fear of having a panic attack on a plane and not necessarily due to aerophobia or the fear of flying. A person with agoraphobia may avoid crowds, fearing the embarrassment of having a panic attack in front of a lot of people. A person with agoraphobia is afraid to leave environment they know or consider to be safe. In several cases, a person with agoraphobia considers their home to be the one only safe environment. They may avoid leaving their home for days, months, or even years. Types of the anxiety is the last main point for my presentation video. So let's move into the conclusion. Anxiety is a normal but highly subjective human emotion. While normal anxiety serve a beneficial and adaptive purpose. Anxiety can also become the cause of tremendous suffering for millions of people. Working from a biopsychosocial perspective, this article provided an overview of the origin and functional purpose of normal anxiety. The biological, psychological, and social factors can contribute the formation and maintenance of pathological anxiety disorder we presented. The various anxiety disorder theories and associated treatments were reviewed. The treatment for anxiety disorders is based on a solid scientific foundation, grounded in research by experts from diverse fields. The research has investigated these biological, social, and psychological factors that contribute to anxiety disorders. This broad research base has led to the development of numerous empirically based treatments that have proven to be highly efficient. As a result, thousands of courageous individuals have reclaimed their health, restored their functioning, and now enjoying richly rewarding and satisfying lives. The future remains optimistic for those who struggle with anxiety. We are confident that advancement in the treatment of anxiety disorders will continue to bring hope and relief to the people and families affected by this disorder. By finishing the conclusion, that is the ending for my oral presentation. Sincerely appreciate your attention today. And that brings us to the end. I'd like to thank you for your time and attention for today. Thank you so much for your interest and attention. Goodbye.